Now is an exciting time for pneumococcal vaccines because we have the money, we can roll out the vaccine, the countries are asking for it, but we need to stay vigilant. We have got to make sure that we get the vaccines to every child, even the most vulnerable in those countries, and that every one of the children who needs it gets access to the vaccines, and that's going to be a big challenge. One of the challenges we're going to face is to make sure that we don't just reach the easy-to-reach children, that we reach the most vulnerable children in every population. And that's actually where the benefits of the vaccine are going to be greatest. The children who we might reach with the vaccines, but who at the same time have a hard time getting to a hospital or clinical care. That's going to mean we need to mobilize communities. We need to maybe work with the private sector. We need to come up with innovative new strategies for reaching children who, to this point, haven't been easily reached with either vaccines or services. And that's where we're going to save a lot of lives when we get that working really, really well. I think probably the most rewarding personally was seeing the vaccine used in Kenya. In 1987, when I was a college student, I lived with a Kenyan family in a neighborhood of Kenya called Kibera, where people don't have very much and there are very limited services available to them when the children become ill. At the time of the rollout of the Kenya pneumococcal vaccine, I actually reconnected with my Kenyan family for the first time in 25 years and was in fact visiting a local hospital on the day that my Kenyan sister delivered her baby. So for me it was a coming together of a lot of things, a life's work to try and make pneumococcal vaccines available, and then to be able to see a baby born to a family that I knew and know that that kid was going to be protected was very rewarding.